Symptoms of depression and research on treatments. This presentation will be discussing what depression is, the cognitive theory for explaining depression using Beck's 1967 study, symptoms that a person may have when diagnosed with depression, Lepine and Brady 2011, and different types of treatments and their effectiveness. I will be evaluating the different types of treatments using some peer-reviewed articles. This includes Drusin et al.'s 2010 study, which explores the psychodynamic approach and the effectiveness of psychotherapy. Butler et al.'s 2006 study, which evaluates using CBT, cognitive behavioral therapy for depression, and Cipriani et al.'s 2018 study on the effectiveness of different antidepressant drugs. Depression is a mental health condition which consists of long periods of low mood and persistent feelings of sadness. Depression can affect how you think, feel, how you behave, your social life, relationships, and can even interfere with daily functioning. Depression can be caused by a combination of genetic, biological, and environmental factors. Risk factors for depression can include a family history of depression, traumatic life events, certain medical conditions, and medications. Cognitive theory is a psychological approach for understanding how internal mental processes such as thoughts, beliefs, perceptions influence behavior and emotions. Beck 1967 published a paper titled Depression, Clinical, Experimental, and Theoretical Aspects, which laid out the foundation of the cognitive theory. In the paper, he introduces the concept of cognitive triad. He suggests that depression consists of having distorted and negative beliefs about the self, the world, and the future. Beck was a practicing psychiatrist, and his work is highly relevant in clinical practice. However, his study was mostly based on clinical observations and individual case studies, and not large-scale empirical research. Therefore, the findings may not be generalizable to broader populations. Symptoms of depression. Symptoms of depression may include persistent sadness, which may occur nearly every day and can consist of negative feelings and low mood. Some symptoms may be overeating or loss of appetite, changes in weight, sleep disturbances, not being able to sleep, insomnia, or sleeping too much, hypersomnia. Feelings of worthlessness, guilt, blaming oneself constantly, feeling worthless, loss of interest, pleasure, losing interest in activities that were once enjoyable, a lack of interest in socializing, fatigue, loss of energy, feeling excessively tired, physically weak, difficulty concentrating, struggling to remember details, and having trouble concentrating. Lapin and Briley 2011 published a peer-reviewed journal titled The Increasing Burden of Depression, where they highlight a few symptoms of depression and the impact it has on the economy. They mention symptoms such as decreased productivity and abstinence from work. Although their journal contributes to the knowledge in the field of depression and its impact on the economy, they discuss various treatment options for depression such as pharmacotherapy and psychotherapy, that may not provide specific help for individual treatment. Treatments for depression. Psychodynamic psychotherapy. Psychodynamic psychotherapy is based on the psychodynamic approach and is a form of therapy that involves talking, and it explores the unconscious mind, early childhood experiences, and interpersonal relationships that influence a person's thoughts, feelings, and behaviors. Drusin et al. 2010 conducted a peer-reviewed meta-analysis of electronic databases such as PubMed PsycInfo. The meta-analysis found that short-term psychodynamic psychotherapy resulted in significant positive effects in treating depression. The study was a meta-analysis, which is considered to be a strong research method due to the systematic collection of data from multiple studies, as this provides an in-depth overview of existing evidence on psychodynamic psychotherapy. However, the meta-analysis may have included studies with heterogeneous methodologies. This may limit the ability to draw valid conclusions about the effect of psychodynamic psychotherapy. On the other hand, it may be argued that meta-analysis typically involve strict statistical techniques and only high-quality studies are included in the analysis. This counterbalances for the chance of invalid conclusions from heterogeneous methodologies and increases the reliability and validity of the findings. A strength of this research is that meta-analyses tend to have large sample sizes, which increases the statistical power and generalizability of the findings. However, some may believe that the heterogeneity of the methodology could introduce variability, for example, through participant characteristics, limiting the generalizability of the study. Furthermore, the study may have focused on short-term findings, lacking long-term follow-up, which is crucial for analyzing the durability of the treatment and taking into consideration relapses in depression. Cognitive behavioral therapy. CBT, cognitive behavioral therapy, is a form of psychotherapy which involves talking to trained therapists and focuses on identifying and changing negative thinking and behavior. CBT is practiced with the principle that our thoughts, feelings, and behaviors are interconnected, and that by changing our dysfunctional thinking process, we can improve our mental well-being. Butler et al. 2006 conducted a peer-reviewed meta-analysis which tested the effectiveness of CBT for depression using data from numerous randomized controlled trials, RCTs. The study aimed to provide an in-depth analysis of the effect of CBT for depression across different populations. Findings presented a significant effect of CBT as a treatment for depression. The study provides evidence for the effectiveness of CBT for depression. This finding can assist clinicians in selecting the appropriate treatments for individuals experiencing depressive symptoms. However, the study may have focused on results such as symptoms reduction and may have ignored other clinically relevant effects such as quality of life. The meta-analysis had a large sample size and the study included data from multiple RTCs. This would increase the statistical power and generalizability of the findings. However, meta-analyses are at risk of publication bias because studies with significant results are more likely to be published than those with null or negative results. This bias may lead to an overestimation of treatment effects. Antidepressant drugs. Antidepressant drugs are medications used to treat depression by altering brain chemistry. A common antidepressant drug is selective serotonin reuptake inhibitors, SSRIs. Cipriani et al.'s 2018 peer-reviewed meta-analysis study consisted of randomized controlled trials comparing 21 different antidepressant drugs with placebo or other forms of treatment. They found that all antidepressants were more effective than placebo in treating depression. The system for selecting studies may introduce bias if some forms of studies were excluded, as studies with smaller sample sizes or unpublished studies were not included. This means that the findings may lack validity as it fails to consider all the available evidence. However, the study did have a large sample size as it included data from multiple clinical trials. This increases the statistical power and reliability of the findings. A limitation of the study is that it had heavy focus on the positive results of antidepressant drugs, but it failed to provide detailed information on the possible side effects that each medication may have. On the other hand, the study's findings may be useful in clinical practice as it provides valuable information about the effect of different antidepressant drugs, which overall improves the patient care service. Another limitation of the research is that the clinical trials used for the analysis may vary and have different methodologies, which could impact the reliability of the findings. However, the study did comply with the right methodological standards and reported its methods and findings clearly, which increases the validity and reproducibility of the research, further improving reliability. All three forms of treatments for depression have their strengths and limitation, and some treatments may also work better in improving symptoms of depression by combining them together. All the studies which I have critiqued in this presentation are peer-reviewed articles.